Hello and welcome to Healthcare and the Internet of Things. This presentation is from Team 2, Kia Gordon, Iswarya Vigneshwar, Sonja Westbrook, and Aristead Wigfall. In 2009, Congress passed the Health Information Technology for Economic and Clinical Health Act, otherwise known as ITEC. The ITEC Act was created to spur health information technology and promote the use of electronic records as part of healthcare reform in the United States. ITEC stipulated that technologies and technology standards created under ITEC would not compromise HIPAA, or the Health Information Portability and Accountability Act, or its privacy and security laws. Electronic records, electronic health records, and electronic medical records are the result of the desire to go paperless. As medical facilities transition from handwritten notes to computer data entry, other medical information can and should be collected and included in these records. The Internet of Things, or IoT. What is the Internet of Things and why should we be concerned about it? IoT is a network of interconnected objects able to collect and exchange data using embedded sensors. How can the Internet of Things improve electronic medical records? IoT connected devices allow for enterprise-wide data collection. What those devices are and what data they collect should be explored and expanded to include all touch points to patients. This would include wearables such as health trackers, smartphones, or monitors. This could also include possibilities that do not yet exist, such as smart identification bracelets that actually function as multi-purpose units, or garments using smart technology cloth. Smartphones are now monitoring heart patients and diabetics. Devices are paired to smartphones that can monitor various functions without the need to be inside a medical clinic. Fitness trackers are monitoring individual activity and have the ability to report to medical facilities. Wearables allow doctors to monitor patients in real time. Data can be collected from various sources, monitoring a patient into a central data store to produce a dashboard of the patient's conditions. This dashboard can then be monitored for changes in patient status, alert medical personnel, and corrective measures can be taken. With the introduction of IoT, data accuracy of electronic medical records and electronic health records increase. EMR and EHR are currently accurate and have eliminated the chances of things being undocumented in relation to patient care. In conjunction with IoT, information will be able to be shared real-time to providers via wearables and can be transferred to a patient's primary care physician to ensure seamless medical care for the patient. A fully integrated healthcare system via wearables and implementation of IoT increase the likelihood of a patient having better health care by semantic interoperability. Another advantage of EMR and IoT is the reduction of paper usage. Healthcare facilities can ensure more accurate data by collecting the data within the system and reduces the chances of something going undocumented.
Use of data research. The most straightforward and generally accepted application for EHR is assessing trial feasibility and facilitating patient recruitment, and EHR are currently used for this purpose in some centers. Using EHR technology to generate lists of patients who might be eligible for research is recognized as an option to meet meaningful use standards for EHR in the United States. However, incomplete data may prohibit screening for the complete list of eligibility criteria, but EHRs may facilitate pre-screening for patients by age, gender, and diagnosis, particularly for exclusion of ineligible patients, and reduce the overall screening burden in clinical trials. A second and more complex step involves the reuse of information collected in EHRs for routine clinical care as source data for research. Change to work. About 80% of respondents said the biggest challenge in changing EHRs was the time invested required, and 70% pointed to productivity loss as the biggest challenge. Many also said they found it challenging to learn how to use a new EHR and the cost of the switch was burdensome. As of today, about 60% of respondents said their new EHR has useful functionality, and around 55% said their new EHR has allowed them to achieve meaningful use.
Business problem in current process. The main reason for using electronic medical record is easy accessibility. There are many benefits for electronic health record than paper-based health record, like keeping track of medical history, test results, allergies, etc. The main challenge with current EHR is that there is no interoperability. The electronic record obtained in a hospital can only be used if the patient is admitted in the same hospital. Here, data gets logged in specific hospital groups. A case study appeared in Washington Post which states about a 62-year-old woman who reached the hospital stating shortness of breath and explains serious medical complications. But she is not aware of her treatment, results, and medicines. She was admitted in 5 different area hospitals. Now we have data in 5 different hospitals, but it is of no use in emergency. Inadequate patient data can take time to examine the patient, lead to complications and higher mortality. Interoperability not only helps patient in emergency, but also in cases like when a patient is looking for a second opinion or relocation of a patient or doctor, etc. Thus, lack of interoperability is not allowing to utilize the benefits of electronic health record. One such example is EPIC EHR system. EPIC system is a large privately held health IT company best known for its electronic health record system. Some of the nation's largest and prestigious hospitals use EPIC EHR system. Mr. Caldwell stated in a report that EPIC's roadblock is interoperability. He also stated EPIC is not only the vendor with this issue. Rather than creating a device to interact with the system in other hospitals, EPIC focuses on data exchange only between its clients. Though EPIC was projected to be the winner to overhaul Department of Defense Electronic Health Record, it was presented to Cerner. EPIC is pioneer in its field, but due to its drawback, its usage is gradually decreasing. Due to this drawback, now hospitals are in search of third-party applications to handle interoperability. Indranil Ganguly, VP and CIO at JFK Health System in New Jersey states, it would be better if there is a way to share information from one EHR to another without high cost. Hardin Memorial Health has multiple EHRs within its organization and needed to use third-party technology to communicate with each other. This requires hospitals to spend more money on purchasing third-party applications. If large hospitals like JFK Health System, Hardin Memorial Health is looking for an alternative means, it will be definitely difficult for medium-sized hospitals to purchase third-party applications. Solution for the business problem. Internet of Things. It is essential to overcome the communication barrier between medical devices. As wearables usage increases, there is also an expectation to integrate its data with EHRs. These types of data transfer between medical devices in different organizations is possible through Internet of Things. Dimitrov stated by 2020, 40% of IoT-related technology will be related to healthcare more than any other category, making up to a $117 billion market. Internet of Things in Healthcare. Internet of Things in Healthcare allows medical devices to link into a smart network which includes the EHR. It allows clinical data to be shared across the network electronically to any hospital. Patient health record, billing paperwork, information related to healthcare can be stored in cloud. This makes the content easily accessible from anywhere, both by clients and healthcare professionals. Medical devices integrated using IoT can allow real-time monitoring of patient data like vitals. It also helps to track patient status more accurately and helps medical providers to react more quickly for any adverse effects. This figure depicts an IoT-enabled hospital setup. Here, patient is acknowledged using RFID. Their existing medical records, which are stored in the cloud, are retrieved when required by healthcare professional. Data from wearables, which are stored in the database, are also hosted in cloud. It can also be retrieved when required. As patients' data are stored in the cloud, it will be easy to retrieve it in a different hospital. Nexcom developed a medical informatics solution using Internet of Things. This helps to convert medical device data to electronic medical records and send them to the hospital's private cloud. This has been successfully implemented in hospital located in Nanjing, China. Nexcom Gateway NIO100 is a compact and easy to use device specifically developed to bridge the gap between medical devices. It collects clinical data from a wide range of medical devices via registered or standard serial protocols like RS-232-485 and transmits to the cloud using networks like Wi-Fi, Ethernet. It can also consolidate and perform preliminary analysis on clinical data. As the data are stored in cloud, data transfers between different health providers are possible. Now, this hospital is able to improve its medical care, manage EMR, etc. Wearables, which are developed to capture the data from individuals when integrated with patients' electronic health records in hospitals, it will help for better healthcare outcomes through more accurate diagnosis and timely interventions. Spaniel stated that Dexcom, a medical device company, has developed a continuous glucose monitoring device which can be implanted in a patient's body and can transmit real-time information to healthcare providers for timely detection and interventions. Here, through IoT, data is being transferred to the healthcare providers and that can be updated in the EMR. Challenges in implementation. As the patient's data are uploaded in cloud, the major challenge in implementing IoT in healthcare is data security. From the time the data is collected at the device level to the point that it is transmitted over its final destination, securing that information is critical and it is required under HIPAA. But with the lack of common security standards and practices, many health IT professionals have concerns about the risks associated with IoT device and data breaches. The HIPAA regulations apply to covered entities, which include healthcare providers that transmit health information in electronic form in connection with HIPAA covered transactions health plans. It is necessary for healthcare providers to consider HIPAA security rules. Fundamental to privacy security under US federal legislation is the Federal Trade Commission Act. In March 2012, FTC issued a report titled Protecting Consumers, which has key concepts like simplify consumer choice, improve transparency to consumers for maintaining privacy of individuals.
Security issues. One way to increase privacy for EMR is through blockchain. Blockchain is described as a public electronic ledger similar to a relational database that can be openly shared among disparate users and that creates an unchangeable record of their transactions, each one time-stamped and linked to the previous one. Medical records would be shared without having to sacrifice privacy, bringing significant cost savings. Participants exchange data and transaction records that are stored and distributed across all ecosystem participants connected to the network: doctors, insurers, farmers, and the patient. Whoever rightfully owns the key can access the information, and that access can be repudiated instantly. In an ecosystem that is heavily integrated, every patient interaction, whether it is seeing a primary care physician for an annual checkup, getting surgery, or picking up a prescription from the pharmacy, will eventually lead to the submission of a chain for a payer to process. Breakdowns in any piece of the process can lead to significant issues for patients and providers: incorrect application of benefits, delays in payment, and even delays in care. Blockchain can be addressed these issues. Many healthcare organizations and government agencies are publicly exploring the potential of blockchain. These include Humana, Kaiser Permanente, the National Institutes of Health, and the Office of National Coordinator for Health Information Technology. Even so, a continued push for leadership and collaboration among ecosystem players is needed.
EMR enables the use of personalized medicine. A physician will develop a treatment specifically for an individual's disease or need. The benefits include cost reduction, patient compliance, and a most important goal of medicine, to go to prevention versus reaction. This enables the doctors to ensure better health care for a patient and helps the patient become healthier. EMR opens the door for what is called electronic prescribing. EMR is improving the chances of medication referrals and tests and improving medical procedure documentation. Implementation of IoT furthers the benefits by allowing information sharing to various other health outlets for the patient, such as those going to another hospital or visiting primary care providers. In conclusion, IoT connected devices will permit for the collection of data on a larger scale. Smartphones and wearables are now able to monitor patients and deliver information in real time, which in turn allows for medical professionals to react more effectively and efficiently. It is allowing for patients' healthcare records to link across a network and store information related to healthcare in the cloud. This eliminates the problem of medical devices communicating with one another and leads to better communication with EMRs. IoT is the prime solution which helps to eliminate the major business problem in the healthcare field, the communication barrier between medical devices in different hospital setups. Usage of this emerging technology in healthcare is not just an addition of another tool, but an irresistible answer for necessity.